Back on MorningLine, thanks for joining us. We're talking about a wide range of issues, especially focusing in on, the help that's out there for seniors, and we're going to get into a lot of that with Michelle Lacewell and Sara Fowler, both with the Greater Nashville Regional Council. The phone lines are open if you'd like. When we went to the break, we were talking about nursing home care, assisted living. Just one thing, you put money away maybe for retirement, and you don't think how you're necessarily going to have to spend that, but could go toward assisted living. I know there are some long-term care insurance policies out there. That's an option some people can look at, right? And
yeah.
The sooner you buy into that, maybe the cheaper it is if you buy it before you get old, right?
Yeah, and you also want to look into what triggers you to be able to access that policy.
Oh, okay.
Because you usually have to meet a certain level of care or maybe spend so much money yourself. So you want to pay attention to how you can access that policy once you purchase it.
Right.
But they can be great and help you be able to afford care later on.
So as people reach these points of crisis when they get older, you guys provide counseling, right? Or, advice on a number of different things. I mean, when there's, elderly that maybe, get to the point where they can't care for themselves, but maybe aren't family members. I mean, I often wonder, I see it in the news business, where do they go? Where do they end up if they don't have the money?
Yeah. Well, it depends on their situation, as Sara said, but one of our programs that we have that is, it's a really important program that we offer is our guardianship and conservatorship program. And that's where individuals that either because of their situation financially or their capacity or have no support system, and then they come to us to support them. And
now, do they come to you, or how do you find them?
So I'll let Sara walk through that process.
Yeah. They're appointed through the courts.
So the judge is somehow finds. Now, would this be from a family member that's seeking a conservatorship, or could it be Adult Protective Services has discovered someone living in squalor with like 1,000 cats in their house, and it's disgusting, and they have to be removed?
Yes, we've had all of that.
Right.
And whether it's Adult Protective Services, a family member, hospital, they have to petition the courts. And if there is nobody else to assist that individual, and that individual doesn't have the financial means, then we can be appointed their guardian or conservator, which means that we then
you make all the decisions for them.
Yeah.
Right? They may not be willing to cede this, but maybe they're at the point because of Alzheimer's or something else. It's deemed by a judge they can no longer care for themselves.
Yes.
So then it comes to you, if there's no one else, to make decisions for them.
Yes. So that's their health care, financial, even end-of-life decisions.
And so when I guess you talk about resources are pretty thin in terms of what federal stuff. How do you deal with it? Where do they go at this point? If they can no longer live at home, they've been removed from a dwelling, and they come to you with a conservatorship. And by the way, just curious, I mean, how many of those cases do you have like right now? What's the realm of that?
I think we are around, I want to say 65 individuals.
65 right now, okay.
We usually are between 65, and we've been as high as 90, but that really stretches our staff limitations.
Sure. And it really is the last resort conservatorship. So you want to avoid it if you can, because it's basically taking away someone's entire liberty and freedom. I mean, just because they can no longer care for themselves.
Right.
Yes, is why. So, then what do you do then? You have 60 of them. Where are they placed, or how do you handle that?
They're placed in assisted living facilities or different facilities in the region, depending on where they live.
Okay. Is there much space in some of the? Are you talking about nursing homes, assisted living? We talked during the break about group homes.
There are some. We do have some in group homes, and those are the licensed group homes that we work with. So yeah, it depends on their level of care needs. Most of the individuals we work with, again, don't have the financial means other than their Social Security income. So that plays a part into where we are looking as far as their housing and their care needs. So all of that gets looked at, and we have to find the best arrangement.
I know, and it's hard. I mean, Michelle, she talked about Social Security. Look, I know some people don't have the means beyond that, but Social Security, right? If that's all you have in retirement, and again, some people may have no choice on that. Other people maybe didn't get their act together and put away like they should have, instead bought a boat, and that's on you. But if you're living just on Social Security when you retire, that's that's pretty tight, isn't it?
It is, and obviously your choices are really, really limited at that point, because the cost of care is going up every day. And you know, there's the private payer side of provider services that is independent from programs like ours, so that if you or I were to go out and pay for our parents and we were able to just pay the cost of having someone come in their home and care for them, there's more providers out there that will take that private side of the business than the side that we provide through our programming. And you know, the workforce part is a real challenge for providers, just like in every industry. We're finding it to be really hard for the providers that are trying to give really good care to these individuals. The workforce that wants to come into homes and support people, it's really challenging.
And the same way also, I assume for assisted living and nursing homes too. Just finding staffers to work in these places is just difficult. And I think it varies from state to state, but I mean, for a single individual going into an assisted living facility, I'm not talking memory care, which is the most expensive level, it's probably minimum $3,500 a month.
Oh yeah.
Minimum. Okay, you think, I mean, now that's going to include some nursing type care to a degree, meals, dwelling, okay, but that's minimum 35. It's probably closer to 5,000 a month in Tennessee, depending on the facility. You can afford that.
And how long will you need that?
Right. Well, it's going to be years in a lot of cases, right?
Yeah.
And so how do you pay for that? Well, most people right now, I guarantee you watching this say, there's just no way.
It is a very complicated, complex system that exists to support individuals in this space that has a lot of needs to make sure it's successful. Jeez.
All right, listen, we've got some phone calls. Ann and others, stay where you are. We have to take this quick break. And you're first off the top as soon as we come back. Stay with us.